whatever amount of money we put in, there'll always be a sense of rationing. You've got to choose, and we don't use that word, but you've got to choose where you spend your money. And that's the reality of healthcare. And it's the reality of healthcare in every system. It's not about this one or any, you have to choose how money gets spent in the best needs. And that's difficult. And I think the two areas where I see lots of work and effort going on, and again, I think we talk a lot these days, don't we, about having a learning culture, having the willingness to learn and accept that we don't know everything, and evolving and improving over time. And I think that is really important. But the two areas where I see that potential is around work where people are really beginning to say, well, what outcomes matter? So we've been counting stuff for years. We've been counting how many things go through the door. We've been counting how many appointments took place or didn't take place. But what if we really understood outcomes? And what if we really understood outcomes through the perspective of the people we serve? What if they were telling us that their life has got a bit better, or whatever metric is important to them? So I think we need to pay a lot more attention to those outcomes and how we develop those and think about those with the populations we serve. And then the other bit, and I think this is the bit that's particularly pertinent to the people on the call, is well, the outcomes is pertinent because a lot of the people on the call will be experts in saying, look, we can show how we improve outcomes, and are probably also very good at engaging with the people with those outcomes. So that bit. But the second bit links back to your question about money. We have not had a mature system for really understanding return on investment. We've had a cash-based system in a way, if you like. Are we balancing the budget rather than are we driving the best value out of the budget? And I see again, over the last few years, I've seen the voice of public health get louder, and I think that's really exciting. I think there's a real prospect of saying, if we really understand the return on investment, if we really understand what a exercise program or a smoking cessation program or whatever can contribute, and if we can try and encourage a longer term perspective and not just a sort of short term, somewhat politically driven timescale, we've got a real opportunity there to say, let's do the interventions that matter. Now, we can't turn off huge chunks of the system today and just switch the money. We've got to phase that over time. We've got to work out. But I think some of your colleagues on the call today will be, they'll be screaming, I'm sure, saying, we can show the return on investment. How do we get in the rooms to have that conversation? And I think it's on the onus of each and every ICB to say, how is it developing its understanding of return on investment, best use of money? Even if they got really mature at that, you would still have people competing to say, look, our return on investment competing with your return. It's still going to be a difficult decision, but at least you are basing it on, good evidence, good analysis, and good perception of this is where money spent in health and care would yield the most value. And I think for the taxpayers, that would be a huge asset. And for people who are passionate about improving health and outcomes, that would be a good thing as well.